Hi, my name is Rachel. I'm a student at Nightingale College, and today we are inserting and discontinuing an IV catheter. I have no jewelry on, no watch, no polish on my nails, no earrings, my hair is tied back, I'm wearing my uniform, and my badge is in place. Before I begin, I'm going to show you my supplies. I have an IV start kit. I have a saline flush. I have a 20 gauge 1-inch needle. I have a 12-inch IV extension set. I have 2 pairs of clean gloves. I have a sharps container. And I have a step stool trash can that is appropriate. All right, so let's make sure we are good here. Okay, all right. So I'm going to gather my supplies. I'm going to enter my patient's room. I'm going to close the door for patient privacy. I am going to practice hand hygiene, introduce myself to the patient. Hi, Mrs. Smith. My name is Rachel. I'm going to be your nurse today, and we are going to insert an IV for fluids. All right, can you give me your first and last name and your date of birth? She gives me the information. Ms. Smith, can I also see your wristband? I checked Ms. Smith's wristband, so I have 2 forms of identification, and she has been verified. So now I'm going to don a clean pair of gloves. I am going to open up my IV start kit, and I'm going to set everything out. I've got my Tegaderm, my alcohol prep pad, some 2x2s, some tape, and my tourniquet. I'm going to throw this away in the appropriate receptacle. I have my 12-inch IV extension set tubing. I'm going to remove that, place it down, dispose of that in the appropriate receptacle. I have my saline flush. I'm going to dispose of that in the appropriate receptacle. And now I need to prime my tubing. So I'm going to make sure that the tubing is open. So this little gadget here is not pushed back so it's closed. It remains open so that we can prime it. And I'm going to remove both caps with aseptic technique off of the tubing, dispose of those in the appropriate receptacle. I am now going to remove the cap off of my saline flush, dispose of that in the appropriate receptacle. I am going to attach my saline flush to the tubing, and I'm going to prime it, which is removing all of the air out of the tubing. So we're going to push the fluid until we get a few drops. Oh, there it goes. Okay, great. So now it's primed, and I'm going to close the valve here and set it to the side. I'm now going to inspect my patient's skin. I do see a fantastic vein for insertion. And so I found the vein, and I'm now going to apply the tourniquet. So I'm going to apply the tourniquet 10 to 15 centimeters above the insertion site. And that's about 4 to 6 finger width. So I'm going to make sure that I don't do the tourniquet too tight, but tight enough. All right, so the tourniquet's not too tight, and I'm also going to check for a distal pulse. There is a pulse. I also want to see, I'm going to be inserting around right here. So it is within the limit of, it's more than 10 to 15 centimeters. So if you can see my fingers here, and then I have the 4 fingers. All right, great. So tourniquet's on, I have my IV site. I'm going to take my alcohol prep pad, throw this away in the appropriate receptacle. I am going to cleanse my site in a circular motion, starting from the inside and working my way out, making sure that the entire area is clean. Throw this away in the appropriate receptacle. Now I'm going to use my thumb on my non-dominant hand. Well, first I'm going to open my IV. So this is a 20 gauge 1 inch needle. Throw that away in the appropriate receptacle. And I'm going to open it. The bevel is up. I'm going to discard the cap in the appropriate receptacle. And now with the bevel up, you always want to insert the catheter with the bevel up at a 30-degree angle. But first I'm going to, between 4 to 5 centimeters or 1 to 2 inches, I'm going to use my non-dominant thumb to pull the skin taut, making sure I'm at least 4 to 5 centimeters, which is 1 to 2 inches away from my injection site. Now at 30 degrees, with the bevel up, I'm going to insert the catheter until I see flashback. There it is. I do see flashback, and that's blood return. And now I'm going to advance the catheter 1/4 of an inch more. There it is. And I'm going to straighten out my catheter so it's more flush to the skin. And I'm going to push the catheter off of the needle into the patient's skin. And now I'm going to stabilize the catheter. I'm going to remove the needle and I'm going to retract the needle. I'm going to place this directly in my sharps container. Now I'm going to, while stabilizing the catheter and putting pressure, I'm going to remove the tourniquet and I'm going to quickly grab my tubing. I need to release the flow. So I've opened up my tubing, as you can see, that's open. And I'm going to connect my tubing to my catheter. Okay, now I need to see if there is blood return. So I'm going to pull back to get blood return. There is. And so now that there's blood return, I'm going to slowly flush the vein. While stabilizing the catheter with my finger, I flush the vein slowly. So now that the vein is flushed, I am going to close the line. And I'm going to remove the saline flush. I'm going to dispose of this in the appropriate receptacle. And now that my line is closed, I am going to apply the Tegaderm. Dispose of this in the appropriate receptacle. I'm going to apply the Tegaderm just so, but leaving the port open so that we can attach fluids to the port. I'm going to remove the stickers. There we go. And now I'm going to dispose of this in the appropriate receptacle. I'm going to use this piece of tape to attach to my patient's arm, to attach the tubing to my patient's arm. And on that tape, I am going to write my initials, the date, the time, and the gauge of the needle, which is a 20 gauge 1-inch needle. And then I am going to check it, make sure everything is nice and good. I'm going to throw this in the appropriate receptacle. I am going to remove my gloves, throw them in the appropriate receptacle. I'm going to practice hand hygiene. I'm going to exit the room, and I'm going to shut the door for patient privacy and document my IV insertion. Okay, it looks like it is time to take Mrs. Smith's IV out, so I'm going to enter Mrs. Smith's room and shut the door for patient privacy. I'm going to practice hand hygiene. I'm going to don a new pair of gloves. Okay, so we remove the IV by gently peeling off the tape. This is actually, it's very sticky. So while you're peeling it off, making sure that the catheter doesn't come with it, you want to protect yourself and your patient. All right, so let's throw this in the appropriate receptacle. I am going to slide the IV catheter. I placed gauze, 2x2 gauze, clean 2x2 gauze over my catheter, and I'm going to slide it out slowly against the skin, so flush with the skin. And I'm going to apply pressure for 30 seconds. While I'm applying pressure, I'm going to inspect the catheter to make sure that the tip is intact and that nothing was left in my patient's arm. The tip is intact, everything looks good. I'm going to immediately place this in my sharps container. Okay, fantastic. So I am going to hold this for 30 seconds. Okay, it's been 30 seconds and I look and the bleeding has stopped. So I'm going to actually dispose of this in my sharps container because it had blood on it. And now I have a clean 2x2 gauze that I'm going to place directly over. I'm going to take tape and I'm going to tape the 2x2 gauze to my patient's arm. And ask her to leave it on for about 5 minutes to minimize bruising. Now I am done and I'm going to remove my gloves. I'm going to throw them away in the appropriate receptacle. I'm going to practice hand hygiene. I'm going to exit the room and close the door for patient privacy, and I'm going to document my removal of the IV. Thank you.